Good evening, Internet, and welcome to this installment of Fun with Semaglutide. Just a reminder, I am not a physician, I'm not a financial advisor, just telling you my lived experience. I am a trained scientist, however. So we're talking about GLP-1 analogs, so this is semaglutide, GLP-1 analogs, GLP-1 receptors, clinical trials, and the drive from the marketplace. It's only the beginning, what we've seen so far with the semaglutide. And if you're like me, the semaglutide, yes, it's helping me to lose weight, but it's oh so much more than that. And I guess that impact has been experienced by many, because there are many clinical trials going on to address some of these other effects. Let's start with just a quick review of what the semaglutide overview from a high level does. So here in the middle, we have the semaglutide, the GLP-1RA. GLP-1RA stands for glucagon-like peptide. Okay, so it's glucagon-like peptide 1. RA means receptor agonist. That means it is not the native GLP-1. The native GLP-1 has a half-life in the body of around 2 minutes. That means there's a stimulus, GLP-1 is secreted, tries to go bind to a receptor, has 2 minutes to do it before it switches off. Okay, it's degraded, it's shut down. Well, for the body, we need something a little longer. How do you get to once a week for using the semaglutide, the GLP-1RA, the receptor agonist? Well, you need to essentially stabilize the GLP-1. So the semaglutide is the GLP-1, the 2-minute puppy, GLP-1, and attached to that are stabilizing moieties. One binds to serum albumin, so it is stably in a form that is presentable to circulates throughout the body, right? But also it has a DPP4, a peptidase enzyme inhibitor. So you want something that's going to stabilize it. That's a serum albumin, will bind it. That puts it in a serum albumin compartment, if you will. And then you want it not to get chopped up by that peptidase. And so there's another little arm on there that inhibits it being cut up. So that's how they've been able to stabilize it from 2 minutes, which is what the body does, to 7 days, right? And there's some other things going on to make it in pill form, but it's not relevant for this evening's conversation. But that's GLP-1RA in a nutshell. Okay, so goes to the pancreas, going to highlight some of the things it does. Increases insulin synthesis. More insulin means lowering the glucose, right? Stomach reduces gastric emptying, acid secretion, and motility, so you stay full longer. Brain, neuroprotection, neurogenesis, satiety. It's not just that your stomach is fuller longer. There's actually a satiety signal that says, we're fine. We don't need any food. And so then the appetite goes down. So these are the main components that a lot of us who became familiar with, whether it's Ozempic, Wegovy, or semaglutide. And by the way, I'm just going to say semaglutide because if I go through each one of those all the time, it gets you just turn off, right? All right, what else does it do? Heart, it increases glucose uptake. It's protective for the heart. You've probably seen some news already online about how there have been studies that have shown that the heart is significantly improved in a certain period of time. So increases heart, increases glucose uptake, so the heart becomes a more efficient machine. Liver gluconeogenesis goes down. Gluconeogenesis means new glucose genesis production. That goes down. And so if new glucose production goes down, then of course glucose isn't circulating as much, and so glucose in the blood goes down. Remember that for the semaglutide originally they looked at it for type 2 diabetes to reduce glucose, and so you're already seeing the various mechanisms for doing that. Bone formation is good for bones. Muscles uptakes glucose sensitivity, insulin sensitivity. I'm be very curious to see if this effect actually can increase athletic performance. Adipose affects adipose cells, kidneys, renal protection, immune cells. You're going to see on the clinical trials that there's a lot of clinical trials focusing on the immune system. Now, this one is particularly focused on systemic inflammation. So there's lower inflammation systemically going on, right? Because of the immune cells that cause inflammation. Inflammation's a good thing when you're trying to kill a bacteria or a viral invader, right? You want inflammation, you're going to take care of that pathogen. That's a good thing. But when you have a more systemic inflammation, that's suboptimal. So what they've seen already is that it lowers systemic inflammation, but in the clinical trials, you're going to see there's a whole number of immune system clinical trials going on. The eye affects some of the eye, tongue. I've not had this experience. Have you, where the taste sensitivity is increased? I don't know. I've not had that, but who knows? Lungs increase in pulmonary protection. So if you can keep this little picture in mind, because when we go to the clinical trials, you can see, okay, so when somebody is looking at X, Y, and Z in a clinical trial, which system, if one is affiliated with one of these organs, is it? Okay, so let me sit on this picture for a little bit. I'll go on to that in a second. Let's start with this. Wait, I thought we were going to look at clinical trials. This is actually really cool. I'll put the link to it in the description below. This is a yearly report that comes out called the Eye on the Market, Outlook for 2024. And that's because the clinical trials, it's not just altruism. Now, I'm not a person who says that, everything around pharma is just about money, but they are a business, right? So if there are these other profit places that, by the way, has the side effect of making people feel better and be better, cool, okay, I've got no problem with that. But this is on JP Morgan. You can download it. Just Google JP Morgan Pillow Talk or Eye on the Market. It pops right up. And by the way, having nothing to do with this talk, I love this image, right? This is what they described. This was AI generated, the bear market coming in for a soft landing. I think that's pretty cool. But again, I don't know anything about the bear markets. All right, so let me move on to what I really wanted to show you all. So why in this very important annual report, which I guess are read by millions of people, why they had all sorts of, big economic discussions. And again, I'm not an economics person. I'm a scientist. Don't know anything about economics. I'm not a physician. Not giving medical advice, just observations. But they have this whole segment here. The fats dominoes, the impact of weight loss drugs on equity market. So, okay, so the GLP-1s are weight loss drugs, or the Semaglutide GLP-1 RAs are weight loss drugs. They're particularly interested on equity markets, but it's not just around obesity. It's around these other diseases, which I just showed you. So it could be around weight loss, right? Because all these things, stomach emptying, blah, 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 all this stuff, going to make you eat less, going to make you feel more satiated, lower your appetite, you're going to lose weight. All that stuff is cool. But just how much can that affect the equity market? Well, some fast foods, maybe you're going to eat less fast foods, less drive-through. Maybe you won't need a knee replacement because your knees don't have to carry all that weight. Maybe heart stents, whatever. But what about these other things? Beyond that, are there other markets that it's going to affect? And actually they say it is. And so that is then linked to, if you want to know where it's going, then that is going to be linked to these clinical trials. Take a look. I just was tickled by this. Let's go to page 30 here. Thought I could just jump to it. Oh yeah, I can. Okay, so let's go to page 30. And let's scooch down a little bit. Well, because it took us to 28. Here's 30. The fats dominoes, the impact of weight loss drugs. Again, cool AI pictures, right? So what they're going to talk about here is, the GLP-1s and the effect, the efficacy on diabetes and obesity and the equities market. That's cool. Okay. Not really where I'm going with it, but let's continue on down to what we are interested in. Here we are. We have arrived at our destination. So let's first take a look. Does this, the general outline, does it comport with what I showed you a moment ago? Stomach decreases gastric emptying and gastric motility, liver, gluconeogenesis reduced. Okay. Reduce non-alcoholic fatty liver. Now remember, the non-alcoholic fatty liver is a real problem because of the inflammation too, right? Well, the fat getting in there dysregulates to some extent the liver, so it doesn't function as well. But in addition, it has a whole lot of things around inflammation. So this is really cool. So your liver's actually doing better. Was there a clinical trial on that? You bet there is. Brain, decreased food intake stimuli, and reward behavior. I love that, reward behavior. It's like Pavlov, ring the bell. I'm just joking. But it has those other things that we saw on the previous slide. Muscle, increase insulin sensitivity and glucose uptake. Will you be more athletic? Can you run faster, jump higher, longer? I don't know. Pancreas, increase insulin secretion and synthesis, decrease glucagon secretion, all very cool. Let's take a look at the clinical trials. And again, if some of you may be reading up here, and go ahead, if Medicare adoption, that has an effect. Like if Medicare starts to pay for these medications for their participants, Medicare or Medicaid pays for these, then it'll get spread more across consumers who want to use it. Right now, if you're uninsured, you're poor, and you're obese, well, they're not going to help you, and you can't afford it. So it's really a challenge. So here's what's cool. And they say there are currently 20 plus ongoing studies which could expand the list of conditions that GLP-1 drugs are explicitly designed to treat, in addition to type 2 diabetes and obesity. Yeah, between you and me, there are 500 or right around 200 separate categories. Not sure why they reduce it to 20, but okay, doesn't matter. But they do put them down into classifications like cardiovascular. So since they classify it here, that might be what they're doing. So they may use cardiovascular as an umbrella for all the categories that I'm going to show you in a second. So maybe that's how come they did 20 plus instead of 500 or 200 and something. So here's the ones that they're seeing as the big ones. These cardiovascular, obstructive sleep apnea, so heart, lung, kidney, liver, bone, looking like the image I just showed you, right? Alzheimer's disease, brain, peripheral arterial disease. Okay, so that's blood, vascular, cardiac, vascular, all this, and heart, right? So, okay, so if you look back at this, you can see from that list, many of these are touched upon. Maybe not so much. I didn't see all of them, but a good deal of them. Let's go back here. The other interesting thing I noticed here was they listed 1, 2, 3, really 3 main players in the marketplace, and not sure quite how they categorize that, except maybe that they, for some reason, chose these named medications. So the ones here in capitalized are drugs that they're actually testing in these different areas, and the tirzepatide and the semaglutide. Remember that the tirzepatide has a semaglutide component, and then it has another component on it that turns it to a tirzepatide. So let's take a look at what this means for us users of this. So the other players, so if you look at Global Market Insights, at this link, they have GLP-1 receptor agonists. The key players include these other ones here: Lilly, Sanofi, Novo, AstraZeneca, Pfizer, Amgen, Innovent Biologics, Peg Bio Company, and Sun Pharmaceuticals. So they have a few more, and these seem to me like they'd be big players, but maybe they're just not as far along yet, and so they don't have them all in clinical trials. But wait, we can find out. All right, so let me go and open up the clinical trial page. Da-da-da! So right here, so you can find this. I'll put the links in the description. But if you want to find it just on your own, just do clinicaltrials.gov. And I'm looking at the classical method because I guess I'm a classic. It's not old, but what we're seeing here are the 230 conditions. I'm not going to read them all, but I do want to go through this a little bit so you get an idea. So acquired immune deficiency, remember let's go back again, and back to our picture, immune cells, okay? So that's what I wanted to show you, is how they're being perhaps being classified. So all right, let's continue. Let me pull this down so it's easier for me to make changes. So here we have coronary, so heart. Now acute graft versus host disease. Interesting. That's again immune system. Adenocarcinoma, so this is cancer. This may be a surveillance study. Let's take a look at this. Active surveillance program for cases of medullary thyroid cancer. So they want to see if there is a connection. There were some modest numbers. I don't, we can cover it in a separate talk, but that you'll know that when you take this, you have to sign something that says you're aware of the consequences, that there may be cancer involved. So I think I'm happy to see they're doing some surveillance on that will see is how strong is that, how big is that signal, what is it for real. Alcohol, so alcohol drinking, related disorders, alcoholism. So these are could be a combination of metabolic as well as neurological, right? So be very interesting to see how these go. And by the way, over here on this side, you can see the studies, the number of studies. That doesn't mean the number of enrollment. So you can see here, so let's just open one and look at the alcohol one. So there are 5 different alcohol studies. Does semaglutide reduce alcohol intake in patients with alcohol use disorder and comorbid obesity? Semaglutide therapy for alcohol reduction. Semaglutide therapy for alcohol reduction, TULSA. And alcohol use disorder, clinical trial for rebellious semaglutide among adults with alcohol use disorder. And you can see the status, are they recruiting, the conditions, what is the condition? So, you have to have alcohol abuse because they're trying to see if it treats that. Interventions, they're going to tell you a little bit of what they're doing. They're going to use semaglutide, injectable product, and placebo. And then they have it at various locations. And this happens to be in Copenhagen and Denmark, and pretty cool. All right, so now remember, some of the big players in the marketplace are from Europe, and so I could see where they would want to do some of these studies overseas. I'm sure some of them are also done in the US as well, because ultimately they're going to apply for FDA approval. So they need to get the information. So you can see where I'm going with this, and I don't want to go on too long because you could spend a long time here and just hunt things through. But really what you'll see is it appears to be bucketed into these different kinds of symptoms. So immune system, alcoholism, that might be a metabolic requirement, so you have metabolism issues for alcohol. Cancer, so these might be around surveillance for someone. A brain, cerebral vascular disorder, cerebral infarction, cognition disorders. So this is what's going on in the brain. Lots of different studies going on there. Coronary diseases. Interesting, COVID, I found this fascinating. Semaglutide to reduce myocardial injury in patients with COVID-19. So remember those, again, back to the slide. The heart, where's the heart? Here's the heart. Cardio protection. So does this help it? So what I'm going to wrap it up here, because I tend to be a wanderer on these kinds of sites, and I could dive into these and spend hours, and only I would be entertained by that. So let me wrap it up and encourage you to go look at this site. And as you're looking through your experience with semaglutide, if you're on whatever formulation of it, have you had any, does any of this ring true for you? I mean, you know, do you feel like you've been thinking better, things clearer? Sometimes that's just because you're eating better too. So you have to be kind of clear on, you know, is that just because I'm eating less crap and so I'm feeling better and so I'm thinking better? Maybe it's that. Or maybe I feel like going for a walk because my heart is able to uptake glucose better, as is my muscles. So I'm feeling more capable. I'm just curious if you want to share if you've had experiences like this. As I've said, I certainly have. Cognitively, whether I'm staying on a ketogenic diet, which is where I lean toward trying to get to, and I'm in ketosis, this impact on cognition is still there, even if I'm eating a little bit of ice cream and things like that, which might be why I only lose 2 pounds a month, but losing it anyway. I was gaining 2 pounds a month before, so net I'm losing 4 pounds, right? That's the new math. Anyway, that's it for me. I hope you enjoyed this video, and I hope there's a lot more cool data to come. Thanks, everyone. Bye.